Welcome back to the channel. Today, we're diving into a crucial medical topic, the differences between dry gangrene and wet gangrene. Now I know what you're thinking. Gangrene, that sounds pretty intense, Doc. And you're right, it is a serious condition. But don't worry, we're gonna break it down in a way that's easy to understand. We'll be covering the key differences between these two types of gangrene, from their causes and symptoms to their diagnosis and treatment. By the end of this video, you'll have a solid understanding of these conditions and be better equipped to recognize the signs and seek medical attention if needed. Remember, knowledge is power, especially when it comes to your health. So let's get started. First up, let's talk about where these types of gangrene typically occur in the body. Dry gangrene, as the name suggests, is often found in areas where blood flow is limited, like your fingers and toes, the furthest points from your heart. Think about it like this. Your circulatory system is like a highway system and your blood is like the traffic flowing through it. The further away you get from the heart, the city center, the slower the traffic. Dry gangrene sets up shop in those areas with less traffic flow. Wet gangrene, on the other hand, can develop anywhere there's a bacterial infection that's gotten out of control. This could be a wound that gets infected, a surgical site, or even internal organs. It's like a traffic jam caused by a major accident. Things get backed up and messy fast. Now let's get down to the nitty-gritty of what actually causes these conditions. Dry gangrene is like a slow and steady decline. Imagine a neighborhood slowly losing power, street by street. That's essentially what happens when blood flow to a particular area is reduced or completely cut off. Without enough oxygen-rich blood, the cells and tissues start to die off. It's a gradual process, but it can have serious consequences if left untreated. Wet gangrene, on the other hand, is more like a sudden and chaotic event, a flash flood of infection. It's caused by bacteria invading the tissues, multiplying rapidly, and releasing toxins that cause cell death. This leads to swelling, inflammation, and a rapid spread of the infection, which can be life-threatening. Let's zoom in even further and see what dry and wet gangrene look like under a microscope. Dry gangrene presents as coagulative necrosis. Basically, the tissue dries up, shrinks, and turns dark brown or black like a dried-up prune. The cells lose their structure, but the overall architecture of the tissue remains somewhat intact. It's like a building that's been abandoned. The walls are still standing, but everything inside is gone. Wet gangrene, in contrast, shows liquefactive necrosis. This means the tissue is literally breaking down and liquefying due to the action of enzymes released by bacteria and white blood cells. It's a messy process with pus formation and a characteristic foul odor. Now this is where things get a little graphic, but it's important to understand the difference. Dry gangrene is relatively clean, meaning there's no pus involved. It's just the dead, dried-up tissue. Wet gangrene, on the other hand, is characterized by the presence of pus, a thick, yellowish fluid that contains dead white blood cells, bacteria, and tissue debris. This pus buildup is a sign of your body's immune system fighting the infection, but it also contributes to the foul odor often associated with wet gangrene. Imagine a battlefield after a fierce fight. The aftermath of wet gangrene is similar, with the body trying to clear out the damage caused by the bacterial invasion. Chapter 5. Line of demarcation. Where does it end? One of the key visual differences between dry and wet gangrene is the presence or absence of a clear line of demarcation. Imagine drawing a line in the sand. In dry gangrene, there's a distinct boundary between the healthy tissue and the dead, gangrenous tissue. This line is often visible to the naked eye and helps doctors determine the extent of the damage. It's like a clear border separating healthy territory from the affected area. In wet gangrene, this line of demarcation is often blurred or absent. The infection spreads rapidly and erratically, making it difficult to determine where the healthy tissue ends and the gangrenous tissue begins. It's like a wildfire spreading uncontrollably, making it hard to contain. Chapter 6. Bacteria, the usual suspects. We've talked about bacteria playing a major role in wet gangrene, but what about dry gangrene? Well, dry gangrene is typically not caused by a bacterial infection. It's primarily a result of reduced blood flow, like we discussed earlier. However, bacteria can sometimes colonize the dead tissue in dry gangrene, leading to a secondary infection. It's like scavengers moving into an abandoned building. They're not the original cause of the problem, but they can make it worse. Wet gangrene, on the other hand, is always caused by a bacterial infection. The most common culprits are bacteria from the Clostridium species. particularly Clostridium perfringens. These bacteria are anaerobic, meaning they thrive in environments without oxygen, like the dead tissue in wet gangrene. Chapter 7. Prognosis. What's the outlook? Now let's talk about the prognosis for each type of gangrene. The good news is that with prompt medical attention, both dry and wet gangrene can be treated. However, the outlook is generally better for dry gangrene. Since it progresses slowly and has a clear line of demarcation, it's often easier to manage and treat. Treatment usually involves removing the dead tissue and restoring blood flow to the affected area. Wet gangrene, unfortunately, has a poor prognosis. This is because the infection can spread rapidly and lead to serious complications like sepsis, a life-threatening immune response to infection. Early diagnosis and aggressive treatment are crucial for improving the chances of recovery. Outro: stay informed, stay healthy. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more medical insights. Understanding the differences between dry and wet gangrene is crucial for early detection and treatment. Remember, if you ever notice any signs of gangrene such as discoloration of the skin, pain, swelling, or a foul odor, seek medical attention immediately. Early intervention can make a world of difference. Stay healthy and informed.